The Norfolk State University Nursing Program Class of 2023 is proud to present its Community Health Project. To help communities throughout Hampton Roads, each student created a public service announcement with tips for health and well-being. Students worked with a public health communications expert and a media expert to combine their knowledge gained in the nursing program with coaching on effective communications. The results are informative, creative clips inspired by the students' experience and interests. They are accessible to the general audience.
Your blood is red, codes are blue. We're NSU nursing students here to talk to you so you don't catch things like the flu and maybe some other stuff too.
Hi, I'm Kendrick Adams, a senior nursing student at Norfolk State University. Let's be honest, you're stressed. Now, are you dealing with this stress in a constructive way? There are so many ways to properly handle the stress of life. Some things to improve stress are to start an exercise program, meditation, journaling, and even getting outside help. All of these things can be used to lessen the amount of stress that you're experiencing in your day-to-day life. By reducing stress in your life, you lessen the chances of experiencing high blood pressure, diabetes, and heart problems. You will also help your sleep. And who doesn't love sleep? And please, don't be afraid to use a support system to give you some relief from your stressful life, because taking a break isn't always a bad thing.
Thanks for listening to today's health tips in collaboration with the NSU Nursing Department and its Center for Public Health Initiative. Your blood is red, codes are blue. We're NSU nursing students here to talk to you so you don't catch things like the flu and maybe some other stuff too.
Hello, this is Franco Ahmed, senior nursing student here at the nursing department in Norfolk State University. Did you know most people get colds around winter and spring? Well, whether rain or shine, the best way to not get a cold is to remember to wash your hands for about 20 seconds with soap and water. The next time you go out to eat with your friends, try washing your hands beforehand. Did you know the CDC recommends, if you already have the cold, to disinfect frequently touched surfaces and objects, such as toys, doorknobs, and mobile devices? If your symptoms last more than 10 days, make an appointment to see your doctor. Something so small makes a big difference. Remember to cover your cough, and don't forget to drink plenty of water.
Thanks for listening to today's health tips in collaboration with the NSU Nursing Department and its Center for Public Health Initiative. Your blood is red, codes are blue. We're NSU nursing students here to talk to you so you don't catch things like the flu and maybe some other stuff too.
My name is Lyric Mitchell. I am a senior nursing student in the nursing department at Norfolk State University. For today's topic of health tips, it's a deep one. We're going to talk about domestic violence. Domestic violence isn't just physical. It can be verbal or emotional from family, friends, or a significant other. To know if you're in a domestic violence situation, you need to know the signs. These can include feeling like you're isolated, feeling like they are jealous of you, or maybe even possessive. The hotline on the virginia.gov website is there for my people in the Hampton Roads area. Don't turn that red flag into a green one. All I'm saying is that if you are in danger, please take the necessary steps to get yourself to safety. Y'all be safe out there, and remember the hotline is always available.
Thanks for listening to today's health tips in collaboration with the NSU Nursing Department and its Center for Public Health Initiative. Your blood is red, codes are blue. We're NSU nursing students here to talk to you so you don't catch things like the flu and maybe some other stuff too.
Here's some of that other stuff too. My name is Jennifer Hernandez, and I have an important tip for you. Have you thought about going to therapy? A lot of people do, but the thought of going to therapy is often viewed as something negative. I'm here to tell you that it isn't. I started going to therapy a few months ago, and let's just say it's been life-changing. You become self-aware and learn what triggers you and how to cope with those feelings. You learn how to reframe any negative thoughts into more positive ones. So again, life-changing. As a Hispanic woman, therapy has always been taboo, something we don't dare speak of. Let's break these generational curses and go work on ourselves so we can be our best selves. Let's be proactive rather than reactive. #Hazlo para ti, which means do it for yourself in Spanish.
Thanks for listening to today's health tips in collaboration with the NSU Nursing Department and its Center for Public Health Initiative. Your blood is red, codes are blue. We're NSU nursing students here to talk to you so you don't catch things like the flu and maybe some other stuff too.
Hello,
My name is Lauren Henderson, and I am a senior nursing student here at Norfolk State University. Did you know that approximately 1 in 5 people in the United States are diagnosed with an STI? Safe practices are known to be effective when put into use. Therefore, it is important to be aware. Discussing previous sex partners, utilizing health screenings, getting vaccines, the use of condoms, and abstinence are ways to eliminate and decrease the risk for sexually transmitted infections. Be smart with your decisions and treat your body with care. STIs are on the rise. One night of pleasure does not amount to a lifetime of suffering. For more information on safe sex practices, visit thecdc.gov.
Thanks for listening to today's health tips in collaboration with the NSU Nursing Department and its Center for Public Health Initiative. Your blood is red, codes are blue. We're NSU nursing students here to talk to you so you don't catch things like the flu and maybe some other stuff too.
Have you ever experienced heartbreak and didn't know how to cope with it? Heartbreak can come in the form of losing a loved one, breaking up with your partner, and even losing yourself. I can admit I've dealt with heartbreak, but I moved past it, and you can too. Heartbreak can cause so much stress and anxiety, but a great way to manage that feeling is to adopt healthy coping mechanisms. Some mechanisms such as journaling, exercising, and meditating has helped me, and I'm sure they can help you too. If you would like to learn more about coping mechanisms that can help you, head on over to psychocentral.com. That's psychocentral.com. Now don't forget, heartbreak is normal, but you can move past it.
Thanks for listening to today's health tips in collaboration with the NSU Nursing Department and its Center for Public Health Initiative. Your blood is red, codes are blue. We're NSU nursing students here to talk to you so you don't catch things like the flu and maybe some other stuff too.
Hi everyone, my name is India and I'm a nursing student at Norfolk State University. Today, I want to talk to you guys about drunk driving. Are you aware that every day 32 people in the United States die in drunk driving crashes? That's one person every 45 minutes. So, how can you reduce this number and be a responsible driver? It's simple. If you are drinking, do not drive. Number 1, plan a safe ride home. 2, if someone you know has been drinking, do not let that person get behind the wheel. And 3, if you're hosting a party where alcohol is being served, make sure all your guests leave with the sober driver. Last but not least, always wear your seatbelt. And remember, your actions could save someone else's life. Safety first, you heard it from a nurse.
Thanks for listening to today's health tips in collaboration with the NSU Nursing Department and its Center for Public Health Initiative. Your blood is red, codes are blue. We're NSU nursing students here to talk to you so you don't catch things like the flu and maybe some other stuff too.
Hello, this is Denise Smith, a senior level nursing student at Norfolk State University. Cheating? Who said that? Being in a relationship is all about being able to motivate and uplift each other into being each other's best self. It is a new day and we are leaving toxic relationships all the way in the past. So today, I'm going to give you guys an acronym for healthy relationships that I came up with based on tips from Planned Parenthood. The acronym that I want you to remember is CARL. C is for communication, A for asking questions, R for responsibility, and L for listening. Don't forget to be open with your partner and tell them what you want and what you need. #healthy relationships.
Thanks for listening to today's health tips in collaboration with the NSU Nursing Department and its Center for Public Health Initiative. Your blood is red, codes are blue. We're NSU nursing students here to talk to you so you don't catch things like the flu and maybe some other stuff too. Hey guys, it's Nurse Mia back with another health tip, and today we're going to talk about exercise. More so, how the lack of exercise can contribute to things like high blood pressure, diabetes, and heart disease. Just a bunch of things we don't have time to deal with. So, my health tip for you guys today is to make sure you're taking at least 20 minutes out of your day to exercise to reduce your chances of these life-changing diagnoses. Some things you could do to reduce these chances are taking the stairs instead of the elevator, parking in a further spot from the grocery store just to get the extra couple steps in, and walking to class instead of driving or taking a scooter. And these are small changes you can make in your everyday life to just make a big change. Check out the CDC website for more tips about exercising. Thanks for listening to today's health tips in collaboration with the NSU Nursing Department and its Center for Public Health Initiative.
Thank you to these amazing students for this community service, which will be aired on WNSB and other platforms. Check the NSU website after May 19th at the URL noted here for more details. Behold!